Hi, this is Jeff Zeig in Phoenix, Arizona in the training room of the Milton Erickson Foundation with another 5-minute tip for therapists. In the last segment, I talked about the confusion technique, a destabilizing method. Well, hand in hand, the other side of the coin is that in unison, you're using associative methods. Associative methods could be like telling stories that sets off a chain of associations that can lead a person into recombining those associations into adaptive states. Erickson was famous for using stories. When I started doing therapy, after getting my master's degree in 1973, the idea that you can use an anecdote, that you could tell a patient a story, well, that was a foreign idea at the time. And gradually, over the decades, therapists have recognized that what patients do when they come to therapists is they tell stories, and that a politeness is for the therapist to use stories to create associations in the client's mind, associations that can begin to drive effective behavior. Now, the interspersal technique, at first when Erickson wrote about it, was for pain control. The patient was a florist. He was in the hospital. He had a tracheotomy. He couldn't speak very well. None of the nostrums of the day were helping him with pain. He was communicating by writing. Erickson was invited into the hospital. The patient had a daughter who was studying psychiatry and didn't even necessarily believe in hypnosis. And Erickson didn't even start by talking about hypnosis. He came in, he started talking about plants, and then he eased the client into the fact that he was going to talk about tomato plants, but that's not what the client really wanted to hear about. And then Erickson started the interspersal. You can imagine, the client that Erickson called him Joe, you can imagine that a tomato plant can grow with a little seed, and the seed can, Joe, rest comfortably in the bed. And then there are the rains, and the rains come and they bring Joe peace and comfort. And the little seeds has cilia, and the cilia begin to grow, and they help the plant to be secure in the bed, Joe. And Erickson wove this interspersal, fascinating Joe with the associations that he was creating. I'm exaggerating a little bit, using one voice to talk on the social level, another voice to talk on the psychological level, and perhaps Erickson did that, but I hope not as obviously as I was just doing it, and then started Joe on a train of activity that modified the experience of pain as Joe carried it out. Erickson was waking up images, associations, memories that would help Joe to obviate his immediate pain as Erickson was talking about the growth of a tomato plant. I strongly recommend that you read that article, The Interspersal Technique for Pain Control. But Erickson would do similar things. It's this process of signification, a process of orienting towards. I don't know if this story is true or not. Perhaps it's apocryphal. But Erickson was working with a man who wanted to stop smoking, and Erickson starts to engage the man in a very vivid story. And in the middle of the story, as an apparent non sequitur, Erickson says to the man, "Well, would you like a cigarette?" And the man says, "Oh, yeah." And Erickson moves the cigarettes, puts them somewhere close, but then suddenly fascinates the man again with the story. And he's telling the story, probably interspersing things as he's doing that, and the man becomes fascinated with the story. And then Erickson says again, "Well, would you like a cigarette?" And the man says, "Oh, yeah." And Erickson moves the cigarettes, does something, but then again fascinates the man with the story, and eventually says to the man, "Would you like a cigarette?" And the man says, "No." And Erickson is creating a reference experience for helping the man engage in the state that he wants to. And he's doing that by talking on the social level about one thing, doing other things on the psychological level. The outcome of communication is determined on the psychological level. Every communication has both a social level and a psychological level. And hypnosis, Ericksonian therapy, is the way in which we learn how to sculpt the psychological level of communication. Hypnosis is the technology of using psychological communication. Ericksonian therapy is a technology of how to use the psychological level of communication to awaken resources in clients. I advise you, recommend to you that you look into the interspersal technique, think about how you can begin applying that in both hypnosis and psychotherapy. This is Jeff Zeig with another 5-minute tip for therapists. Thank you.